Well, even I'm a plastic surgeon, I use a lot of EBDs. I want to talk about the way these EBD, laser radio frequency, help us in our practice and at the office. My conflict of interest. This is a survey of ISAPS 4 years ago, in which one we found that non-surgical procedure increased 10% in compared with the decrease of the average of surgical procedure. But it was made by injectable solutions. 2 years later, in pandemic time, we have a great decrease of the surgical procedure, but we still have an increase of non-surgical procedure at this time made by total other. When they say total other, it's EBD. This means that it's really important the use of EBD for plastic surgeons nowadays. This happened too in my country, in which one the amount of the total of non-surgical procedures is exactly the double of surgical procedures. When we talk about the classical indication of these EBD procedures, we talk about facial resurfacing, acne sequel treatment, skin tightening, and the ablation or epidermal ablation like keratosis, warts, and navy, but there's no classical indication. For me, it's really important. I'm going to show you the way I work on spider navy, ruby navy, senile angioma, vascular malformations, delivery device, xanthellamas, synangiomas, and the way I use the laser and wave frequency to make a blepharoplasty. These are my tools, my toys too. I work every day with that. CO2, a picosecond device, IPL, diodo laser, and wave frequency platform. These two phrases are always compiled in my mind: better and fast result, worse post-treatment recovery time. This is true. And another fact that less and slow result have a gentle post-treatment recovery time, and we need to decide that both patient and me have the wet goal for each of them. When we talk about skin improvement, I use, for example, the CO2 for obtaining a periorbital resurfacing, as you see here. And these are my results. Not only to remove the pigmental lesion, that is really easy with any kind of ABD, but if you can see close to the periorbital area, I was successful to erase the wrinkles. Or in this case, with these great wrinkles, I want the periorbital area in the way that we use an ironed effect. As you can use the iron over a t-shirt, it's the same with the CO2. But you need to always keep in mind that the post-treatment recovery time are worse, no less than a month. For example, this case is a patient of mine that I performed a facelift in the past. She returned for a second facelift, and I said, no, we need to work about the quality of skin, not for the saggy skin. And you can see a great result, not only to erase wrinkles. Look at the upper eyelids in the way I obtain a skin tightening, I obtain a reduction of the size of this skin. Well, when we talk about laser wave frequency blepharoplasty, on my hand, it's without surgery. I never use the CO2 in the surgery room. Here is the before. As you can see here, the patient had a complete indication for a surgical procedure. Saggy skin, wrinkles, fat pad, and skin laxity on the upper eyelids. This is my patient in the first month with these great rednesses, but look the patient at the 6th month. She still have the fat pad for sure, but don't have any kind of wrinkle and have a skin tightening of the upper eyelid, and he's really happy with the result. And this is again the same patient in a close view. I take the color of the photo to have a measure of the result. And better too is still my patient, a year of control and 2 years of control, and she had a success result of the erasure of the wrinkles. Another case of laser blepharoplasty with the stacking method means that you put the laser and apply several times in the same point. In this way, you can set more energy, more heat to the skin. Again, take out the color and you measure not only the reduction of the skin pigmental lesion, at the same time the wrinkle too, and a little decrease of the skin in the upper eyelids. If I perform the stacking in a temporal area, as you can see here, we can change the direction of the tail of the eyebrow. Go down and go up. Yeah? It's only made CO2 in the temporal area, no more than that. Again, another great result. I need to call the patient and ask if I perform a Botox on her because I don't remember that. It's only by stacking in a temporal area, and you can go put the tail of the eyebrow in the upper position. In a young patient, stacking on the upper eyelids in the way I can make a reduction on the skin. Another patient in the periorbitaria area, and it's better to show the same patient 2 years after and look the quality of the skin, complete and have a permanent solution for at least 2 years. It's not a short time. When I mentioned a radiofrequency blepharoplasty, I combine fractional and microneedle at the same time. And by this way, I can obtain a contraction of the skin, but with a gentle post-treatment recovery time. It's more session, not less than 3 or 4, but more gentle, only 3 days of rednesses. There are different kind of microneedle. I prefer the non-insulated. And this is the patient that I show you during the procedure with only 1 session, and the result, look the quality of the skin, look the reduction on the upper eyelids, and better result when I complete the 3 sessions and the reduction of the skin in the upper eyelids. This patient is really happy with me. I performed a facelift, chin implant, and rhino modulation, but in the profile, the patient is still happy, but in the front view, I don't cut good enough surface of the skin in the upper eyelids. I don't happy with the result, the patient too, and request me to ask to a solution, and I give a non-surgical solution by radiofrequency. Look the size of the reduction before and after, only by radiofrequency. If you have an IPL device, you can apply 5-aminolevulinic acid, and you can obtain this kind of result with this reduction of the wrinkle in the periorbital area, as you can see here. In a young patient, 40, again, the reduction of the wrinkles. Another patient, the reduction of the wrinkles, only by IPL. Hollywood peel, the patient requests directly this kind of treatment for us. It's easy to give the indication. It's only for reduction of the size of the pores, make glowing, and give a little more quality in the skin, no more than that. But in the USA, they mentioned that the laser branch, because the redness is only keep for 2 hours, no more than that. And this is the quality of the skin in the periorbital area, the reduction of the pigmental lesion and the size of the porous. Another patient, I apply layer B. I'm going to show you what is layer B. Again, the same patient in another profile. When you talk about acne sequelae, you need always to remember that there are a lot of scars. It's similar like that. That's why we can erase all of them, but we can get improved. Like in this case, look in the middle face, close to the eyes, the way we can ironate the skin. Another patient, really bad quality of skin and fixed patty 4, difficult patient, and the result. Another patient with fixed patty 4, again, the result. And this is layer B. If you use a Q-switch laser, this is a picosecond laser, and use a focus dot, you can obtain little vacuola inside the dermis. You damage the dermis, our body notices that, and create more collagen cells to fill up these vacuolas. And that's why you can make thicker the skin, and you can solve this problem of, for example, acne scar sequelae. I'm going to give you a close view, and again, take out the color to measure the result. Look the temporal area and the way I can get improved in the holes. When we talk about vascular lesion, pore wine stain is another problem around the eyes, around the orbital area. This was made by IPL, another case by IPL, another case by IPL too. Spider Navy, you can use any kind of ABD. In this case, I use a CO2, only one session. I can be successful with this result. Rosacea is going to be forever, but we can change the quality of the patient during several months by IPL. Another case of IPL. When we talk about pigmentolation, we need to use only Q-switch laser. This is my advice for you. To obtain the dendritectomy concept, only no injury the core of the cells, only the dendritectomy, sorry for the words. And we can be successful over the melasma in 4 sessions, like this case. Another case of melasma, another case for lentigos, I want the periorbitaria area, melasma plus lentigos, birthmarks, lentigos and keratosis, dark cycles 2, dark cycles on the male, and Otanevi is a really difficult case, only by Q-switch laser. Please don't try with another kind of IBD. Another Otanevi. Tattoo removal is frequently the patient asked to remove cosmetic tattoo over the eyebrow, or in this case, the patient tried to simulate hair. We can use the laser like a scalpel. We can use to erase warts, or nevus. Or in this great case of santelasma, if you try to use the scalpel, you can obtain a great problem for the patient. You can use a graft on the face, never got the same quality of the skin or the surrounding tissue. That's why the best indication is the use of CO2, like in another case, or for syringiomas, it's the same. Other technology that I try to use in the last years is the plasma radiofrequency. You obtain some point of epidermolysis, and by this way you obtain a contraction in the upper eyelids. Here is this plasma effect, as you can see here when I take out the light in the room. And this is the little success on this area, but are cheaper devices that maybe help you in the practice, in the daily practice, or the use of transdermal radiofrequency, to obtain only increase in the quality in the skin, no more than that. Conclusion. Medical technology are the best assistant for a plastic surgeon like me or dermatologists at the office practice, help a lot of obtain a good result, a complete result on your patient. Fashion medical technology, they have a lot of indication, it's really versatility. Every day we have a new indication. Put your focus in no classical indication because you obtain better results. Not only is a matter of cut, solve saggy skin is not the same as solving quality of the skin. Thank you so much.
Any question?
Thank you very much, Fabian, for your input. I have a question. You say you don't do it at the OR. The laser, it's at the office.
Yes.
You never combine during the surgery some CO2 laser or
Yes.
another device. You have a specific reason for that, or?
Really good question. First, because I am the owner of my devices and I try to keep it safe. I never move it from my office. I have a center with 4 rooms, 4 laser rooms, and I'm happy to work in this way. If I try to move my laser to the surgery room, for sure I'm going to have problem with the optics or something like that. When I try to rent a CO2 in a place that I perform the procedure, because I don't do a surgical procedure in my center, it was a mess. Never see the same device, never the same parameters. That's why I prefer to doing that. I perform the surgical procedure first, and then to the quality, and obtain a complete result. And the patient are happy with me, and I'm happy with the result.
Okay, and just last question for me. How you manage the timing? Because we know that EBD gets some impact about HA or even fat grafting in the area. So are you starting with ABD, a laser, for treating in your?
Same as Steven. If I use, I perform a filler, synthetic filler or fat filler, I try to avoid no less than 3 months before I start doing ABD. And if I use microneedle, more time, because I go really deep inside the skin and I can destroy my work. I can destroy my filler.
Okay, thank you.
Anyone else? Well, I have 2 questions for you. One is, do you use the plexer in every kind of skin, white or black skin?
You mean about the color skin?
Yeah.
Yeah, well, I show you some cases of FIPA 4 and 5. I am FIPA 4, and from Argentina, we have a mix of color of skin. For sure, if you choose CO2, you want to obtain PIH, or a hyperpigmental post-inflammatory reaction. You need to notice that, tell that to the patient, warn about that, and handle with that. And which way we do handle? You use inhibitor of melanin, as tranexamic acid, as hydroquinone, as kojic acid, something like that. Before the procedure, 1 month is the best, and 3 or 6 months after the procedure.
Okay. How often do you use a second section after the using of the radiofrequency?
Always 3 or 4 sessions, never only 1. Radiofrequency is too gentle to have a solution for the skin, for wrinkles, for pores. You need at least, on my hand, 3 or 4 sessions. Different of CO2.
How long do you wait from a session for another?
Good question. My rate is every 15 days. Every 15 days, in 2 months, I complete the treatment.
Okay, thank you. Anyone?
Okay.
So now we will call Sebastian.